monde. Bienvenue. Welcome to today's press conference. I think we can get started. The doctors are going to be with us. They have some opening statements to make, and then we will take questions. So without further ado, Dr. Tam, I cede the virtual floor to you.
Thank you so much, and bonjour à toutes et à tous. Nationally, the weekly case counts are down by 4.5% compared to the last week, and average daily numbers of people with COVID-19 in hospitals and ICUs have declined by over 15%. However, the SARS-CoV-2 virus is still circulating widely, and the epidemiological situation is variable across the country. While some jurisdictions are currently reporting increased case counts, ongoing easing of public health measures could lead to increased transmission in more areas over the coming weeks. Although uncertainties remain in how the trajectory and the virus itself might evolve going forwards, there is no doubt that our best bet is to maintain vigilance. We should not forget the personal protective habits we have learned as we resume activities and return to more settings. Next week will be the 2-year anniversary of the WHO, or World Health Organization, characterizing COVID-19 as a pandemic. Since then, we have had an intense apprenticeship in the prevention and control of this new disease. Individually and collectively, we've learned so much about how the virus behaves and what measures work to reduce the risk of exposure and spreading the virus. By getting vaccinated, millions of Canadians have increased their protection against serious illness. And we have all taken measures to protect ourselves and others by being aware of the risks in our communities, staying home when we're sick, adjusting plans, and adding other layers of protection, such as wearing masks. Now, with a strong foundation of protection from vaccines, proven practices to reduce spread, and less intense pressure on our health system, we need to turn our focus on easing societal disruption. But regaining in-person social and economic activities while the pandemic is still ongoing and the virus is not going away, means we must use all that we have learned to do this safely and make it last. With March break coming up, there will be more opportunities for gatherings, travel, and activities. Going forward, individual risk assessments can become another one of our good habits, as important and routine as checking the weather to decide what activities are best to do and what essentials to bring with us. Regularly checking in on the local epidemiology where you are or where you are going is important for keeping up with recommendations, as well as for making informed decisions on what precautions to use. In particular, if you're traveling this March break, getting up to date with COVID-19 vaccines, including getting a booster dose if you're eligible, and especially for those aged 50 years or older, is important preparation for safer activities and travels. And whether or not they are required in the places or settings you are in, masks remain an important layer of protection. While the virus is still circulating, mask wearing and other personal protective practices offer a way for you and your family to reduce your risk of exposure and spreading the virus. Getting back to more of the people, places, and activities we love is important. This is a time of recovery, as well as time to address the broader impacts of the pandemic, while being ready to respond to future potentially severe waves. By continuing to work together and supporting those at the highest risk in our communities, we will be better equipped to work through future challenges that may come our way. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. À l'échelle nationale, le nombre hebdomadaire de cas a diminué de 4,5% et le nombre de personnes atteintes de la COVID-19 dans les hôpitaux et les unités de soins intensifs a diminué de plus de 15% par rapport à la semaine dernière. Toutefois, le virus de la COVID-19 est toujours largement répandu et la situation épidémiologique est variable dans tout le pays. Si certaines administrations enregistrent actuellement une augmentation du nombre de cas, l'assouplissement continu des mesures de santé publique pourrait entraîner une augmentation de la transmission dans davantage de régions au cours des prochaines semaines. Bien que des incertitudes subsistent quant à la manière dont la trajectoire et le virus lui-même pourraient évoluer à l'avenir, il ne fait aucun doute que notre meilleure chance est de rester vigilant. Il ne faut pas oublier les habitudes de protection individuelle que nous avons apprises à mesure que nous reprenons nos activités et que nous sommes plus nombreux à nous rassembler. La semaine prochaine, il y aura 2 ans que l'OMS a qualifié la COVID-19 de pandémie. Depuis ce temps, nous avons fait un apprentissage intense de la prévention et du contrôle de cette nouvelle maladie. Individuellement et collectivement, nous avons beaucoup appris sur le comportement du virus et sur les mesures qui permettent de réduire le risque d'infection et de transmission du virus. En se faisant vacciner, des millions de Canadiens ont renforcé leur protection contre le fait d'être gravement malades. Nous avons tout pris des mesures pour nous protéger et protéger les autres en étant conscients des risques dans nos communautés, en restant à la maison lorsque nous sommes malades, en modifiant nos plans et en ajoutant d'autres couches de protection comme le port de masque. Maintenant que nous disposons d'une base solide de protection grâce au vaccin, de pratiques éprouvées pour réduire la transmission et d'une pression moins intense sur notre système de santé, nous devons nous concentrer sur l'atténuation des perturbations sociales. Cependant, le fait de reprendre les activités sociales et économiques en personne, alors que la pandémie est toujours en cours et que le virus ne disparaît pas, signifie que nous devons mettre à profit tout ce que nous avons appris pour le faire en toute sécurité et de manière durable. En raison de l'arrivée de la semaine de relâche, il y aura plus d'occasions de rencontres, de voyages et d'activités. À l'avenir, les évaluations individuelles des risques peuvent devenir une autre bonne habitude à prendre, de manière aussi importante et routinière que le fait de vérifier la météo pour décider des activités à faire et des articles essentiels à apporter. Il est important de se renseigner régulièrement sur l'épidémiologie locale là où vous vous trouvez ou selon où vous allez, afin de suivre les recommandations et de prendre des décisions éclairées sur les précautions à prendre. Plus précisément, si vous voyagez pendant la semaine de relâche, le fait de garder à jour vos vaccins contre la COVID-19, notamment de recevoir une dose de rappel si vous êtes admissible, surtout ceux qui ont 50 ans et plus, est le meilleur moyen de vous préparer à participer à des activités et à voyager de façon sécuritaire. Qu'ils soient ou non obligatoires dans les lieux où vous vous trouvez, les masques restent une couche importante de protection. Tant que le virus est en circulation, le port de masque et d'autres pratiques de protection individuelle vous permettent à vous et à votre famille de réduire le risque d'infection et de transmission du virus. Il est important de retrouver les personnes, les lieux et les activités que nous aimons. Il s'agit d'une période de rétablissement et il faut prendre le temps de faire face aux répercussions plus vastes de la pandémie, tout en étant prêt à répondre aux futures vagues possiblement graves. En continuant à travailler ensemble et à appuyer les personnes les plus exposées dans nos communautés, nous serons mieux outillés pour relever les défis futurs qui pourraient se poser. Merci. Thank you, Miigwech.
Thank you, doctors, for that. The doctors have quite a bit of time with us today, so I'll try to get through everyone as quickly as we can. So remember, it's one question, one follow-up, and we're going to start with Adam Hurras from the New Brunswick Telegraph Journal. Actually, Adam, we're going to have to skip you at the moment because it looks like you're using an older version of Zoom. So with that in mind, Boas Plouffe from Le Devoir, you're up.
Bonjour. Vous avez beaucoup parlé du port du masque et du fait que c'est encore pertinent, mais j'aimerais savoir si vous vous prononcez sur le fait que le Québec et d'autres provinces ne le rendent plus obligatoire. Est-ce que vous pensez que c'est encore utile qu'il y ait des obligations de masque?
Merci pour la question. Je pense que j'ai déjà répondu à cette question. C'est sûr que le port de masque est une mesure de protection individuelle bien éprouvée. Mais est-ce que c'est une exigence obligatoire contre, comme il dit, un choix personnel de protection selon, comme il dit, une auto-évaluation des risques? Ça, c'est la question. Je pense que pour les gouvernements, comme le gouvernement de Québec, c'est vraiment de trouver un équilibre entre les mesures plus, comme des restrictives d'un gouvernement comparer à des recommandations de la santé publique et les bons choix aussi, les choix personnels que les gens peuvent en servir. Donc, je pense que si on continue à informer le grand public avec des bons renseignements, et c'est toujours clair que le port du masque est une bonne couche de protection. Peut-être c'est plus important pour quelqu'un qui est peut-être plus à risque, plus vulnérable à cause d'être immunodéprimé. Le port du masque, je pense que c'est une bonne couche de protection. Et aussi, même si ce n'est pas obligatoire, il faut aussi supporter et pas comme des stigmatiser, discriminer contre les personnes qui veulent continuer de porter un masque dans des endroits publics. Merci.
Merci. En suivi, vous parlez du futur, du fait qu'il faut se préparer à des vagues dans le futur. J'aimerais savoir comment on va le savoir si la pandémie est finie et comment on va le savoir si jamais il y a une autre vague qui se représente au Canada. Pourriez-vous nous dire ce genre de scénario?
Merci. C'est une bonne question. Et je pense que c'est pas facile vraiment comment déclarer que la pandémie est finie. Je pense qu'à un certain point, on va accepter que le virus reste avec nous ici aussi à travers le monde pour un bon bout de temps. Et c'est plus une question, est-ce que le virus, comme on dit, aussi le taux de morbidité, mortalité est gérable et aussi avec pas des impacts très rudes sur notre système de soins de santé. Donc, je pense qu'on n'est pas encore là à cette étape, mais je pense que c'est une question de toujours continuer avec notre bon système de surveillance. On a toujours des autres outils, par exemple. On commence maintenant avec, comme on dit, la surveillance des eaux usées. Et c'est bon de continuer avec les indicateurs pour être prêt si peut-être une autre variant préoccupant peut peut-être émerger. Pour l'instant, on est chanceux parce qu'on a dépassé, je pense, que la vague Omicron, mais c'est toujours possible qu'un autre variant préoccupant, peut-être aussi des conséquences plus graves, peut avoir une apparition. Donc, c'est toujours une question de rester vigilant.
Okay, up next is Crystal Oak from Global National.
Hi there. Thank you for taking my question. Can you hear me all right?
Yes.
Oh, great. So I just have a couple questions on Ukraine. So the immigration minister has announced a national interest exemption to allow unvaccinated and partially vaccinated Ukrainians to enter Canada through specific programs. I was just wondering, what is the protocol at the border if those coming into Canada test positive for COVID-19? And are there public health plans in place to accommodate that?
Yes, thank you for the question. Of course, many government departments are working together to support the safe entry of persons leaving the Ukraine. I think that they will be asked to follow the current measures for vaccinated and unvaccinated travelers that arrive in Canada. Of course, we know that it's very difficult to get tested or maybe have the vaccination prior to arrival in Canada. But for those who are unvaccinated, they will be expected to undergo the usual quarantine measures and the testing regimens that are currently in place. And they will be supported in terms of getting vaccinated should that be required.
And as a follow-up, so Ukraine has a relatively low COVID-19 vaccination rate. Are there any new measures or programs that are going to be introduced for refugees who would like to be vaccinated within Canada?
Well, I think the programs already exist, and the provinces as well as the federal government are all very supportive. Anyone who isn't vaccinated with the current list of vaccines approved by Health Canada or those listed by the WHO are all supported in the provinces and territories to get additional doses as well.
Okay, we're going to move on to Yasmin Mehdi from Radio Canada.
Est-ce que vous m'entendez? Bonjour.
Oui.
Excellent. J'aimerais faire un petit suivi sur la question des masques. Là. Vous le disiez, bon, dans certaines provinces, ça sera plus obligatoire. On dit que ça va devenir un choix personnel. Je me demande, vous, personnellement, allez-vous continuer à le porter si ce n'est plus nécessaire en Ontario dans 2 semaines? Ou est-ce que vous pensez que ce sera trop tôt? Ce sera quoi votre choix personnel?
Merci pour la question. Je pense que c'est toujours une question de faire, comme on dit, une auto-évaluation aussi avec un seuil de tolérance de risque. Pour moi, personnellement, c'est toujours aussi une question de regarder c'est quoi l'épidémiologie de la COVID-19. Et pour moi, c'est ici à Ottawa. J'habite ici à Ottawa. Et je pense que pour l'instant, pour peut-être un bout de temps, moi, je vais continuer à porter une masque si je sors de la maison, si je rentre dans les espaces clos, dans les magasins, parce que maintenant, avec les magasins, même les événements, je pense que c'est à pleine capacité. Donc, je pense que pour moi, personnellement, peut-être pour gérer le risque, parce que aussi, même moi, je suis comme dire, entièrement vacciné. Aussi, j'ai reçu mon dose de rappel, mais je peux aussi vous dire que je suis aussi vieux, je suis une personne plus âgée, plus de 50 ans, donc c'est important pour moi-même peut-être de continuer d'utiliser toutes les couches de protection disponibles.
Et ensuite, je veux vous entendre par rapport à cette étude qui a été faite auprès d'enfants à New York sur l'efficacité du vaccin Pfizer face à Omicron. On apprend que la protection contre l'infection chute de 12 pour les 5 à 11 ans. Évidemment, il y a quand même une protection contre la maladie grave et l'hospitalisation, mais quand même 12 c'est pas énorme. Est-ce que vous étiez surpris par ces résultats? Puis qu'est-ce que ça pourrait vouloir dire pour le Canada?
Oui, c'est important de continuer à suivre les résultats des essais cliniques, tout ça avec les vaccins. Et je pense que oui, je suis sûr que Santé Canada, ils suivent aussi la situation. Et ici, on a, comme dit, une soumission et c'est toujours important de comme dit, analyser des données probantes, les données soumises. Et c'est vraiment pour le régulateur de faire leur propre analyse et peut-être avec le but de peut-être approuver ou peut-être pas approuver un certain vaccin. Donc, pour l'instant, je pense qu'avec les vaccins qui sont déjà approuvés au Canada, avec une bonne partie de la population, c'est vraiment pour tout le monde de 5 ans et plus, ça c'est pas mal et je pense qu'il faut continuer avec nos efforts d'augmenter la couverture vaccinale. Mais oui, c'est sûr, on continue à suivre la science et aussi qu'est-ce qui se passe avec les essais cliniques pour les enfants de moins de 5 ans.
Oui, peut-être je peux ajouter quelque chose. C'est pas une étude très grande, donc aussi, je sais que Pfizer est en train de faire un essai clinique concernant la dose de rappel aussi pour les enfants entre 5 et 11 ans. Et on va peut-être obtenir le résultat à bientôt.
Just a reminder, if anybody wants to have a question, please use the raise hand function so I can add you to my list. If you already have your hand up, you are there. But if you have not done so yet and you would like a question, just please do so. With that in mind, up next is Mia Rabson from the Canadian.
Yeah, good afternoon. I'm wondering, Dr. Tam, if you could talk a little bit about how much we know about sort of the natural spread of COVID-19 at this point, how many people have actually had it, given that we haven't really been testing that widely in the last few months, and whether or not that combined with vaccines and the high rates of vaccines we're seeing does give any sense of herd immunity at this point.
Yes, I think we are still waiting for some studies. You've seen of what we call seroprevalence studies. So they measure, they sample the population and measure the antibody levels using a number of different kind of tests to detect antibodies against different proteins, the spike protein and other proteins of the virus. And you can tell the difference between those who got the immunity, perhaps as a result of vaccination only, or also as a result of infection. We don't have that many of those at this point for the post-Omicron situation. So we will be looking at that very closely. But there are some individual studies, for example, in the Montreal area for children and others that are being reviewed at the moment. And there has certainly been quite a large proportion of individuals who actually had the infection during the Omicron wave. And I do think that if it's Omicron that's circulating in the next months, we have a very good level of protection in the community, particularly with boosters, protecting against severe outcomes. But if there's a variant that's very different to Omicron, then that's a different story, and we will have to evaluate the risk of any vaccine evasive variants. So there is no such a thing as a sort of threshold, as it were, for herd immunity at the moment, but I think the level of protection in the community has got to have significantly risen in the last months with increased vaccine coverage and the infection. And that's the same globally as well.
Thank you. I'm wondering if we also have any update on the BA2 numbers versus BA1 and whether growth of that BA2 variant changes things at all, or if it's similar enough to the original Omicron that it would sort of be covered off.
Yes, so in terms of our understanding of the characteristics of the BA2, which is essentially a relative of the Omicron BA1 variant, although there's quite a few differences in the mutations. What the global evidence base has shown is that this is a variant that can be more transmissible, potentially, but there's no conclusive information to say that it causes any more severe outcomes. So that's good news. And the data to this date suggests that the vaccine protection is similar between the two, although there's a few studies that suggest maybe a slight increase in immune evasion from the BA2, but essentially still getting the vaccine is very important, even against BA2 and against severe outcomes. What we're seeing with the Canadian data is that there's been increasing proportion of the identification of BA2 in our population. So at the moment, vast majority are still BA1, or what we call BA 1.1, and roughly 10% are BA2. That's not the same across the country. There are provinces where that proportion is higher, but that's about where things stand at the moment domestically. In our international monitoring through the sampling of travelers, we're detecting a higher level at about 20% of the proportions of travelers with Omicron has the BA2 variant.
Okay, moving on, we're going to go. I want to make sure that that everybody gets a first chance before we move into potentially second round of questions. With that in mind, we're going to move next to Simon Bourassa with Nouveau Info.
Oui, bonjour. Est-ce que vous pourriez, Madame Tam, répéter votre réponse à la question de ma collègue Mia Rabson concernant le variant BA2?
Dr. Tam, tu veux peut-être moi aussi?
Oui,
Oui, vous aussi, peu importe.
Allez-y.
Oh, OK, alors c'est Dr. Njoo.
Oui.
Peut-être je peux résumer. Je ne sais pas, est-ce que vous voulez les chiffres ou...
En fait, je voudrais savoir principalement, est-ce qu'on s'inquiète toujours de la prolifération de ce variant-là et qu'est-ce qui est mis en place là, du côté de la santé publique du Canada pour surveiller l'évolution de ce variant?
OK. Ouais, merci pour la question. Je peux vous dire, et toujours Dr. Tam est prêt à me corriger, qu'à l'instant, on voit que le variant BA2, c'est pas mal semblable à le variant BA1. C'est comme une cousin, on peut dire. Et si on regarde vraiment les caractéristiques importantes, c'est possible que c'est peut-être un peu plus transmissible, mais si on regarde les choses plus importantes comme les conséquences graves, aussi la protection des vaccins vaccin contre ce variant BA2, c'est pas mal différent comparé à la BA1. Donc, c'est quelque chose à suivre au fur et à mesure. Avec notre surveillance, on voit que la plupart des cas identifiés ici au Canada, c'est encore pour l'Omicron, c'est le BA1, mais environ, je pense que c'est 10%, c'est maintenant BA1. Mais c'est pas comme dire pareil partout au pays, parce que je pense dans quelques provinces, notamment Alberta, la proportion de BA2, c'est beaucoup plus haut que peut-être les autres provinces. C'est quelque chose qu'on continue à suivre et avec notre système, même à la frontière, on voit que peut-être le taux de positivité, c'est même un peu plus élevé, c'est peut-être environ 20%. Parmi les voyageurs qui arrivent à nos frontières, qui ont un test positif pour le Omicron, le variant BA2.
D'accord, merci, Dr. Njoo. Là, je comprends que vous voulez responsabiliser les gens dans la gestion individuelle du risque de contagion pour les semaines à venir, bon, puis avec la relâche. Mais est-ce que, entre vous et moi, là, selon vous, est-ce que vous recommandez quand même aux gens d'éviter de se déplacer ou d'éviter de voyager à l'étranger, ou vous leur donnez le champ libre là, tout en se responsabilisant?
Je pense, premièrement, qu'il faut toujours regarder c'est quoi la situation épidémiologique ici au Canada, mais aussi à travers le monde. Et c'est sûr parce qu'on voit que le gouvernement du Canada, maintenant, on a changé les conseils pour les Canadiens et Canadiennes. Avant, c'était vraiment éviter tous les voyages non essentiels à l'étranger, mais maintenant, c'est plus ces recommandations que hey, il faut toujours peut-être regarder où est-ce que vous voulez aller à l'étranger. Pour moi, personnellement, je pense que c'est encore une question de faire une évaluation des risques individuels. Si on est peut-être quelqu'un plus âgé, peut-être avec des autres conditions sous-jacentes, c'est peut-être plus un risque pour voyager à l'étranger, mais ça dépend aussi à quel pays, c'est quelle destination. Donc, il y a beaucoup de facteurs, mais chose que je peux vous dire que moi, je pense que tout m'est tanné à moi-même. Je pense qu'il y a beaucoup de Canadiens, peut-être maintenant, c'est le temps, peut-être prendre un voyage, peut-être au sud avec la semaine de relâche. Mais si je peux vous dire quelque chose, il faut absolument, d'après moi, assurer que tout le monde est adapté avec les vaccinations. Tout le monde est admissible avec au moins les 2 doses et aussi une dose de rappel. On a déjà dit, particulièrement pour les personnes plus âgées, 50 ans et plus. Et aussi, peut-être, rester confiant et de peut-être utiliser toutes les couches de protection. Si un port de masque, c'est une autre couche de protection qui donne une certaine confiance pour peut-être faire certaines activités à l'intérieur. C'est toujours une bonne idée, même si ce n'est pas, une demande obligatoire à la destination. Donc, je pense que au fur et à mesure, je pense que les Canadiens, sont prêts à d'avoir les responsabilités peut-être un peu plus personnelles pour prendre les bonnes décisions pour gérer le risque gérer le risque d'exposition aussi à la COVID-19 et aussi faire les activités comme voyager à l'étranger comme avant.
Merci, Doc.
Okay, next up, Nick Boer from CBC.
Good afternoon, doctors. Just a question about the provinces, which are moving, in some cases, pretty quickly right now to lift some of these restrictions. There could be a situation, depending on which province you're in, where in the near future you could go do karaoke at a packed bar without having to show a vaccine passport or even be vaccinated, but you couldn't get on a train, say, and go to another province. Is there any risk from a public health perspective when you've got Canadians living under what may be quite different rules in the near future?
I think there is different epidemiology in different jurisdictions. So I do think that following local public health advice and watching what that forecast, if you like, of activity is in the local jurisdiction. But when you're talking about interprovincial transportation, that's slightly different. And maybe you're traveling across Canada from one spot that's a hotspot to another spot that has very little activity. So I think that kind of risk assessment still has to be undertaken. But I do know that federal government departments, including Transport Canada and others, are watching all of the changes in epidemiology very closely, and we'll be making any policy adjustments as needed in the coming days and weeks.
Okay, and another question, if I can, on the kids and vaccine topic. We've heard concerns from various public health people around the country about the relatively lower rate of vaccination among children. If we're moving to this point where a lot of restrictions are being lifted, parents are maybe less inclined to get their kids vaccinated, what does that say to you about the outlook for the rest of the pandemic, for the rest of the year, if we have maybe sort of topped out at the vaccination rate that we're currently at for kids?
Yes, I think first of all, we should continue to provide information to parents, check out our videos on talking to experts, and seek out information from your own trusted experts about children's vaccination. So that is still important. I think having those foundational 2 doses is important, because if another variant occurs and you need another dose and you're starting with 0, that means a lot of time has to be expended in getting that series started as well. So I think that's just something to bear in mind. And as we prepare for even the fall season, coming out into the spring and summer, we might expect less transmission, at least in the Canadian context. But we're all trying to look towards the fall now, where not only will COVID-19 potentially increase in terms of activity, but also the other respiratory viruses. And children are susceptible to many different respiratory viruses, and more protection and different layers of protection against them will be very important. I would say, the younger the children and the under 5s, we're still waiting to have authorization for those vaccines. And especially under 1, they are even more susceptible to severe outcomes. So that's something that I think we need to make sure all parents are cognizant of. I do think that as we open up spaces, social economic spaces, as people travel, we will expect an increase in cases. And I think that's just to be expected. But people can, especially if their kids have high-risk conditions, use many different layers of protection, particularly getting the adults around them vaccinated, as well as Dr. Njoo and I keep saying, mask and other measures, ventilation, etc., can help keep our kids safe. But yes, unvaccinated populations can certainly be the pockets of increased transmission into the future.
Okay, I'm going to try to go back now to Adam, and we'll see if this works. And if not, I will ask questions on your behalf. But we're going to go to Adam Harris from the Telegraph Journal.
Thanks, Jordan. Good afternoon. Thanks for taking our questions. The federal government's still providing millions of rapid tests to the provinces, but I was just wondering if there comes a time when widespread testing will be phased out, or if that's something that could be continuing for years.
It's Theresa Tam. I'll try and answer that question. Yes, the rapid tests, many of them have been developed, and many of them authorized, becomes important tools. I do think that there are periods of ebbs and flows of use, if you like, for them. I think I can see going to the future. So there's less value in using them when activities are low. But there's more value when activities increase, or when you have increased respiratory infections and you don't really know what you have, then a rapid test could potentially assist in telling someone whether they have COVID-19. We have to make sure everyone understands how to interpret those tests and the limitations of those tests. So that education is another one of those, increase measures that we can take going forwards. So I don't know the final answer to your question. We will have to keep watching the evolution of the virus and the pandemic. But it's great to have that additional tool. And we can flexibly use it into the future if we have to, even if we're not doing more regular testing.
And with provinces lifting restrictions, does testing regimes become more important in the interim or not?
Well, I think, again, they are supplementary to a number of other measures, including the regular surveillance programs and the regular PCR testing programs. But I think they are very useful if someone has symptoms and you don't know what it is, and you're opening up society and someone has symptoms, then I think the rapid test could be valuable under those circumstances. You've seen provinces now beginning to adapt their testing strategies. Nova Scotia, for instance, is now able to follow up with PCR confirmatory tests even after a rapid test because the numbers have come down a bit. So I think these tools will be used in conjunction. But I do think that as provinces are opening up, we're going to be monitoring the wastewater surveillance. We're going to be monitoring PCR, and the public can leverage rapid tests if the activities are sort of going up in their local environment.
Well, we're going to move on to second round. And so if you do still have a question, please remember to raise your hand. I see two up already. So we'll start the second round. Yasmine Mehdi from Radio-Canada.
Oui, on en a brièvement parlé tout de suite, mais je veux revenir sur cette exigence qu'on a encore au Canada d'être vacciné pour prendre le train, prendre l'avion. Jusqu'à quand cette mesure va être en vigueur? Est-ce qu'il y a un échéancier? Puis ça va être quoi les critères pour mettre fin à cette exigence fédérale?
C'est Dr. Njoo. Ce que je peux vous dire maintenant, c'est qu'on continue toujours de suivre étroitement les données probantes. C'est quoi la situation épidémiologique au Canada, aussi à l'étranger, et aussi, comme on a déjà constaté, même peut-être à la frontière, qu'est-ce qui se passe avec le taux de positivité des tests. Et donc, je pense que c'est les bonnes nouvelles parce que peut-être, par exemple, à la frontière, on a vu pendant les dernières semaines que le taux de positivité particulièrement parmi les voyageurs entièrement vaccinés a vraiment diminué. Maintenant, je pense que c'est comme quelque chose de 2,8 et c'est bon parce que c'est quelque chose beaucoup plus bas qu'avant et c'est quelque chose on va considérer pour peut-être analyser, examiner la situation et c'est sûr peut-être au futur peut-être un peu ajuster.
C'est ça, je sais qu'il n'y a plus de test PCR pour revenir au pays qui est obligatoire. Il y a un test rapide en revanche. Comment est-ce qu'on peut justifier cette mesure en ce moment qu'on sait que ces tests rapides ne sont pas particulièrement fiables puis qu'on a une transmission communautaire qui est bien établie au Canada? Là, quand vous dites on va réviser éventuellement, quand puis c'est quels critères que vous observez?
Oui, merci pour la question. Pour l'instant, oui, c'est toujours comme on a déjà dit que c'est une autre couche de protection d'avoir l'exigence pour, comme on dit, un test moléculaire ou rapide avant peut-être à l'arrivée au Canada. C'est sûr, je pense que pour peut-être tout le monde, peut-être pour un vol, c'est peut-être une assurance qu'on sait que tous les autres passagers dans un vol aussi ont eu, comme on dit, un test négatif, mais on sait que ce n'est pas parfait. Et on voit que même les personnes qui arrivent au Canada, peut-être, comme je viens juste de dire, qu'avec les vols, ont encore, comme on dit, un résultat peut-être positif avec l'arrivée. Mais je pense que le taux de positivité est beaucoup plus bas qu'avant. Et c'est quelque chose, oui, on continue à examiner comme on dit, la situation, la politique, et c'est quelque chose à suivre. On va donner nos recommandations aux décideurs avec toujours avec les bonnes données probantes à date.
Up next, Mia Rabson from the Canadian Press.
Hi again. I'm just wondering, you've talked a little bit about needing to make your own choice about wearing a mask if it's no longer mandated. I'm wondering if you could just talk from your own experience or your own plans, how long you would intend to wear a mask, or what might convince you that a mask isn't necessary anymore for yourself.
Maybe I'll let Dr. Tam go first. I think I answered it in French.
Yes,
so.
I think Dr. Njoo answered it in French. So I think first of all, looking at the activity level in the community that I'm living in or I'm visiting. So I know that in Ottawa, for example, the level of activity is going down. So that's good news. Then I look at, well, what activity am I undertaking? Is it outside? Is it inside? Is it crowded? Who am I going to be with? And I'll still be taking those kind of evaluations. I'll take into account my own personal underlying medical conditions, but also the fact that I have elderly parents, for example. I may want to protect them more. So therefore, I'm not going to take as many chances. And if I visit them, I might wear a mask, depending on the activity. So I think it is very personalized, but I do think that as the Omicron wave comes down, there'll be much more opportunities for people to feel more comfortable in removing the mask. I know that I've been vaccinated and boosted. So personally, I feel quite well protected against severe outcomes. So I'll take that into account for sure.
It's Dr. Njoo. I just maybe to add to what I said in French, similar to Dr. Tam, certainly every time I leave the house, as we actually said in our opening remarks, you would, just like you would look at the weather forecast before you go and make sure that you're properly, dressed to have the appropriate quote equipment which you need before you go out. Depending on the weather, same thing now. Depending on whether I'm going to, let's say, a crowded location indoors, let's say for shopping, as opposed to maybe an outdoor activity, that would certainly, factor into, whether I would feel it necessary or appropriate for my risk to wear a mask or not. And then, like I said, I think in French also in terms of, the possibility of traveling outside of the country. I think many Canadians are looking at that as they go down maybe south or to other locations. And it's the same thing. You need to look at your own personal situation, your risk factors, and then obviously look at the situation of where you're going and what's the epidemiology, like how widely is the virus circulating in your destination as opposed to where you've come from. And then, of course, look at what kind of activities you're going to be doing. If you're going to be spending most of your time outdoors, maybe, hiking and, without too much contact with other people, that's a different kind of risk compared to recognizing that you're maybe going to a vacation outside the country where you will be mostly indoors, maybe bar hopping or whatever, where there could be lots of people indoors, et cetera, and so on. So I think it's all a matter of taking all those factors into account, and then obviously, based on your own risk tolerance, whether you would want to continue wearing a mask or not in those circumstances.
One other point that I think Dr. Njoo mentioned in French that I think is actually important to repeat is actually showing compassionate and support for others. I think, whether you decide to wear a mask or not, think about who you're with, and maybe they're at higher risk. So having that consideration for others, do not stigmatize people who do wear a mask. Or indeed, there's maybe very good reasons why you don't need to wear a mask under certain circumstances. And so people need to be patient as we begin to learn to come out of that crisis phase into more of a longer-term ongoing management of COVID-19. It's not going to be easy. Putting on a specific measure is sometimes hard, and for people to follow what public health is asking them to do. But once a habit is developed, we hope that this just becomes part of your routine respiratory virus precautions that you would take with you on an ongoing basis. But it is not going to be easy. I can see there are tensions, there are fears from those with underlying risk factors that they're going to be going to spaces where people are not respecting those layers of protection anymore. So I think I would ask everyone to be really patient with each other during this time of transition.
You said earlier in your opening remarks that it's sort of time to ease some of the societal disruptions, but we might have to be prepared again if things change or if another variant comes up. But I also remember, and it was you or others saying when Omicron came that this wasn't March 2020. We've learned a lot, we know a lot more, and yet our response was very similar. The same kind of closures, schools closures, business closures, those same very disruptive societal changes. What can we expect if there's another variant? Do we have the ability to make choices or restrictions that aren't as severe as what we've seen so far?
Well, I think that is the goal. Public health systems across the countries really want to minimize those really restrictive measures, but they may ask people to wear a mask again, for example, for indoor settings. So using some of those measures, I think what has been really difficult to balance this reduction of severe outcomes against societal disruption is the fragility of the healthcare system. So I think during this time of recovery, it's really important to look at health human resource and shore up that hospital infrastructure, your long-term care infrastructure and preparedness. Of course, the public health system itself needs to recover as well. But it was really difficult because of hospitals filling up again and the concern that maybe ICUs will. It just so happens Omicron has less severe impacts, and we've been more vaccinated. But I do think we've got more treatment options now. We've got vaccines, and we will know more what to do with different kinds of boosters. And we have rapid tests, which even at the beginning of the Omicron wave wasn't that widely deployed, but it escalated. And so I think with all of those measures and understanding viral transmission, wearing of masks, ventilation, etc., we've got to be able to go into the fall and winter season, or indeed the next wave, if it should come in between, with much more ability to respond without those really severe restrictions. That is the goal, but we still need to be flexible with the suite of measures should it become necessary. And it's very different, for example, I think in different areas of Canada where the healthcare system capacity may differ. And that's why I think you saw, even right at the beginning, some of the smaller jurisdictions taking more measures because they simply can't afford to have a rapid escalation in their health care system impacts. So it is very difficult, but I am optimistic, and we work with the provinces to see if we couldn't, make sure that balance is maintained and improved upon.
I know we've gone through 2 rounds. I as moderator, I'm going to use my privilege here to ask a question too, just to follow up on something you just said, Dr. Tam, which is shoring up the healthcare system. I'm wondering if you can elaborate a bit about how much has been done to do that, maybe in the 2 years, as you point out, since we've entered this pandemic, but also maybe how much more still needs to be done in your mind before you could say mission accomplished.
Yes, and that is, of course, quite a big question, which the decision makers need to grapple with. I do know that a lot of work is being done right now to look at the strengthening of healthcare systems in many ways. I think the biggest need is in the health human resource, particularly when the health teams are so exhausted. And so I think there are many different avenues of exploration. And I'm not really the lead on the healthcare system, so I'm going to have to point you back towards Health Canada and the minister himself, maybe, to take those questions. But we have learned quite a lot. One is, I think, looking at the surge capacity requirements. I really feel that the partnership with the Canadian Red Cross, for example, has been particularly important. They've played a really big role in providing surge as needed, but there's a finite number even of that resource. The federal government itself provided our own staff to some of these situations. And as you can appreciate, the Canadian Armed Forces cannot just keep surging. They've got many other priorities, as you've seen globally with different activities right now that's taking up their area of focus. So training requirements, looking at licensures with the regulatory bodies across the country on really making sure that we've considered how we leverage international graduates and credentialing different health professionals in that area. All of these come into play, I think. And this is a subject that is of great importance, but I might not be the most knowledgeable about that. The other thing is virtual care has become a real reality and was boosted during the pandemic. So knowing how to best use that for going forwards, I think would be very important as well.
Thank you for that. We still have just a few minutes, and I know there's only a few people left on the line. So if anybody has one final question, you can use the raise hand function, and I will squeeze you in now. Seeing none, I think we can wrap up for today. Dr. Tam, Dr. Njoo, thank you very much for your time as always. Thank you to everyone for joining us. That concludes today's press conference.
Thank you.
Merci. Bonne fin de semaine.